Right now on Up with KREM, COVID crisis in North Idaho. Hospitals are in critical condition and they're running out of resources.
Across state lines, Washington hospitals are seeing an increase in COVID patients needing ventilators. This morning, we take a closer look at how the most recent COVID cases compare to those in Idaho.
Gonzaga coach Mark Few issues a statement apologizing for his recent DUI citation in Coeur d'Alene. We have the very latest on what this could mean for the team.
And of course, we're going to take you outside and talk reducing air quality throughout the day as temperatures once again soar across the region.
Up with KREM begins now.
The COVID crisis in North Idaho has taken a critical turn for our local hospitals. Good morning and thanks for joining us on Up with KREM. I'm Channing Curtis. The Idaho State Department of Health just activated what's called crisis care standards for hospitals in North Idaho. We're following these developments closely, and this morning we have Up with KREM team coverage. Tim Pham is in the studio breaking down what an activated crisis means for hospitals in our region. We also have a closer look at current COVID cases and hospitalizations in the Spokane and Coeur d'Alene area. Also, Nicole Hernandez is taking a look at Kootenai Health as health leaders there are desperate for more help due to a surge in serious COVID cases.
Kootenai Health says they are already spread thin because of the number of COVID-19 patients they have in their hospitals. They say if they get any more patients, the level of care that they will be able to give will not be the same. Here's what it's like inside the hospital right now. Kootenai Health converted conference and classroom space into bed space. They set up 22 additional beds in the Health Resources Center. 7 of them are already being used. Plus, they did delay elective surgeries. And Kootenai Health Chief of Staff says the one way we can get out of the situation is with vaccines.
You know, I don't like mandates just like any other person in this area, but I do think that people need to make better decisions. And that if they want to make a personal choice, there is a right personal choice and there's a wrong personal choice. And right now, doing nothing is the wrong choice.
Another area being affected by the current situation at Kootenai Health is transfer patients. Normally, they only have to decline 15 transfer requests over the course of 3 months, but these past 3 months, they've had to deny 300 patient transfer requests. Right now, the hospital is caring for 113 COVID-19 patients. 39 of those are in the ICU, 19 were on ventilators as of yesterday. And last week, to help out, Governor Brad Little did reactivate 150 National Guardsmen to come to North Idaho to help the hospitals, and they're also asking for help from retired and inactive nurses. In Coeur d'Alene, I'm Nicole Hernandez.
So over the past few weeks, we've heard the term crisis care used a lot, but what does that actually mean? Crisis standards of care is a last resort for many hospitals, and it means the number of patients outnumber the available healthcare staff and resources. So this is currently the case for Kootenai Health and many other hospitals in North Idaho. The hospitals are overwhelmed with unvaccinated COVID patients, which will now affect someone seeking emergency care. Hospitals in crisis care will use non-patient care areas to treat patients, and these could be office spaces or classrooms, anything that isn't normally a patient care space. Hospital staff may be unable to adequately care for the large number of patients. Supplies might be lacking, with the possibility of redirecting life-sustaining resources. Someone near death from illness may receive only comfort care, as hospital staff will use limited medicine and life-saving equipment on patients with a high chance of recovery. Idaho health officials are warning these extreme measures could be put in place statewide if the situation does not get better. More than 95% of COVID-19 patients in Idaho are unvaccinated. So here in Washington, hospitals are seeing a 34% increase in COVID-19 patients needing ventilators. As of Tuesday morning, 251 patients are on ventilators. Healthcare officials say the Idaho hospital crisis will affect Washington hospitals. So we want to turn things over to Channing Curtis. Channing, what are we looking at nationwide?
Now, Tim, new this morning, President Biden will be announcing a new strategy to fight the coronavirus. He's expected to make this announcement tomorrow. COVID cases are up dramatically. The weekly average is 300% higher compared to last Labor Day. Deaths are also up, and officials fear it could get worse. Hospitalizations are 3 times higher than last September. Now, while the Delta variant continues its deadly sweep across the U.S., health officials say they're keeping a very close eye on a new variant that may be able to bypass coronavirus antibodies. The nation's top health expert says the Mu variant is serious, but isn't an immediate threat compared to the Delta.
So when we say we're keeping an eye on the Mu variant, we want to make sure it doesn't become more dominant. We actually don't know what the consequences would be. The concern is that it has a constellation of mutations that would indicate that it might evade the protection from certain antibodies. That's what we mean when we say we're keeping an eye on it. But right now, it is not an immediate threat, even though we take all of these variants very seriously.
This month, the World Health Organization says more studies need to be done to confirm whether the variant could evade existing antibodies. Now, our coverage on the hospital crisis in North Idaho will continue in our next half hour. But for the very latest information, text the word COVID to 509-448-2000. We'll send you a link right to your phone with all of that info. The time is now 7:06. Let's take a look at the forecast with Jeremy Legoo, because Jeremy, things are about to get hot around here, at least for a day or so.
Oh yeah, okay. There is an end in sight this go round. That's the bit of good news for places like the Rockies, you know, the southern Rockies, not the northern Rockies by us, but down by, say, Denver. Oof, yeah, it's going to be wildly hot for them. So anyone traveling there, yeah, good luck. For now, for us, that's looking pretty good. Early on this morning, temperatures aren't too bad. 62 here in Spokane. We've got some cloud cover, 60 in Coeur d'Alene, 50 in Sandpoint. How about 60 in Moses Lake and 67 there in Wenatchee? When it comes to air quality, we're in the low 60s or moderate. We trend between moderate to unhealthy for sensitive groups today. Moderate tomorrow, and that's as wind picks up across the region. Southerly wind means all that wildfire smoke hanging to our south blows in. That's why we see that reduction in air quality. But it also is going to elevate fire danger today. However, there is a bit of a saving grace. As we see the wind pick up across the region, see that moisture? See it falling apart as it moves through the middle part of the state? The good news is that's enough moisture that it actually keeps our fire danger from reaching that critical level or red flag warning level. So as this shower system kind of moves in, you can see it just moves toward us, kind of misses us, but it's got enough moisture in the atmosphere to keep our relative humidity levels high enough that we don't have major fire concerns. What we get instead is more sunshine this afternoon and those warm temperatures Channing was talking about. Later today, we're in the upper 80s. To put this in perspective, this is late July, early August temperatures. And keep in mind, we're now headed into the second week of September, so it is going to be a warm one.
Another big story we are following this morning. Gonzaga's head men's basketball coach was cited for a DUI in Coeur d'Alene this week.
Now, Coach Few was called in by a driver who spotted him driving erratically and speeding. He was stopped around 9 p.m. on Labor Day in Dalton Gardens. Now, according to the police report, he did not complete a field sobriety test, but did blow at a .12 blood alcohol level. The legal limit is .08.
New overnight, Mark issued his first statement saying, quote, "I believe as a leader and role model, I'm expected to set only the best example. The decisions I made yesterday do not exemplify this standard, and for that I sincerely apologize to you." He also added, in particular, "I am sorry for the hurt that I have caused to those most important to me, my family, my players, and my program." A DUI in Idaho can mean up to 6 months in jail, a fine of $1,000, and a license suspension, and up to 180 days.
So let's talk about what this could mean for the team. So if there is a game suspension longer than 3 games, it could be a pretty big deal, as the Zags are taking on Texas in the Kennel for their 3rd game of the season. It's expected to be one of the biggest games in Kennel history. Now, right now, we don't know who would take over as the number 2 person, but as of today, the next time we are slated to speak with Coach Few is next month at Craziness in the Kennel on October 9th.
It is time for your morning rush. More news in less time.
A Washington teen is warning her peers to take COVID-19 seriously and get vaccinated. 16-year-old Casey Weldon got COVID over the summer. Now, originally, she didn't think much of it. However, she soon got very sick and developed a hole in her lung, which eventually collapsed. She spent a month in the ICU.
No matter what, you never know how COVID will hit you. It does not matter if you're healthy or anything like that. You just don't know. COVID is insane.
Now, 7 weeks since her diagnosis, Casey says she still isn't fully 100%. She plans to get her vaccination as soon as she can, though, and she says she will tell everyone she knows to do the same.
Anyone planning on attending a Seattle Kraken game this fall will need to show proof of full COVID-19 vaccination. The Climate Pledge Arena announcing they will introduce a seamless process to allow guests to show their proof of full vaccination on their smartphone. Many other arenas in Seattle, including T-Mobile Park and Lumen Field, will be requiring proof of vaccination status as well as masks. WSU Athletics also say they will require proof of COVID-19 vaccination for all home games. Now, the policy applies to everyone over the age of 12, and they also are asking masks. They're saying that it's required for football games moving forward. The vaccine policy takes effect in October, while the mask policy takes effect this Saturday.
Well, here's some exciting news because The Price is Right is coming to the Inland Northwest. The popular game show is coming to the Northern Quest Resort for 2 shows in November. Contestants will be able to win prizes and play popular games such as the famous Showcase Showdown. Tickets go on sale for The Price is Right Live on September 10th. Well, that's your Morning Rush. More news in less time. Let us know what's going on in your neighborhood by using the hashtag #UpWithKREM on social media.
Students are continuing to head back to the classroom this week for their first day of school, and we want to see your pictures. Send us your first day of school picture on social media or by using the hashtag #UpWithKREM. And then also you can text us 509-448-2000, and we'll be taking a look at them all morning long.